I am Brittany Prince Evans, and I am the CEO and founder of WellStart Initiatives. So you probably never heard of WellStart Initiatives, so I'm going to give you our mission. So WellStart Initiatives is dedicated to the development and implementation of strategies that will decrease health disparities while empowering underserved communities through health education, advocacy, and promotion. So you're probably wondering how I probably came up with this vision. So I want to tell you about my pain to purpose. On the slide, you probably see the picture of my leg, which I'm going to tell you the backstory about my pain to purpose. So I am 6 feet without any heels. So I was very athletic growing up. And at one point in my life, ball was life, hard to imagine, right? So the one day that I decided to wear high heel shoes, the heel of my shoe got caught in a floor vent on the ground. The floor vent flipped up and sliced my ankle open. Yikes, I know. So of course, when crazy incidents happen like that, you get rushed to your local hospital. So I went to my ER and they told me to wiggle my toes. Because I could wiggle my toes, they told me that my Achilles tendon was not affected. So I got stitches, I went on my way. When I got my stitches taken out, I was able to also get orders to go to physical therapy. So I'm taking physical therapy. I was also going to open gym with my teammates at the time, as well as just lifting weights with my teammates as well. So I am, pushing myself. I'm lifting weights. I'm going to open gym. I am killing it at physical therapy, but I was always in excruciating pain. I didn't understand why I'm not getting any better. I honestly thought it was a mental thing. So I was like, I just got to keep pushing myself a little bit harder. Just keep going, keep going, keep going. I even had resistant bands so I could actually do the homework that the physical therapist, taught me to do while I was at home, stretching my leg, just stretching, constantly going. I wasn't getting any better. My mom noticed it as well. I also noticed that my cut was not healing correctly. It was like something that was oozing from it. And at the age that I was, I didn't think about any infection or anything like that. So my mom took me to a neighboring county for a second opinion. I immediately found out that I had an infection in my leg. And then they ordered a MRI on my leg, and I found out that my Achilles tendon was indeed torn. I tore it in September, but I didn't find out about it until November. So that is 2 months constantly working, constantly doing physical therapy, lifting weights, and putting all this pressure on my leg. Because I was doing all of these different activities, it caused my Achilles tendon to move 2 inches away from the bone. I got my surgery done in December. And the normal Achilles scar is probably about this long, but as you can see from that picture, my Achilles tendon scar is definitely longer than the average person. I had over 50 stitches, and I was not able to walk on my own without any assistance until April. I was even homeschooled for a small period of time as well because I wasn't mobile. So I had one of my teachers to come over to my house to give me work. It really didn't register to me how your zip code can have a impact on your health outcome until I was at the University of South Carolina, where I was then had a different major before I changed over to public health, where I took a elective course in public health, and they talked about health inequities due to zip codes. And it just hit me. I was like, oh my gosh, I was infected by this same thing. So I'm in class, I had my laptop up, I just started Googling. I even found out in 2012 that my hospital, the same hospital that treated me, was ranked the top 25 worst hospitals in the entire nation. And on top of that, I just started researching just different stats for my county, which is Clarendon County. We have amazing citizens, amazing people. However, we have high health inequities. And Clarendon County alone, our life expectancy rate is 75 compared to South Carolina, which is 79. That's 4 years that we're missing. Also, our poverty rate for children is 79%. It's 39% compared to South Carolina, which is 26%. Now, I want you to, giving out these stats, South Carolina is not the best state for health inequities as well. So for my county to have higher rates is just through the roof. It's crazy. Obesity rate for South Carolina is 32%. Compared to my county, Clarendon County, is 40%. And for the poor health rate in South Carolina is 19%, but for my county, it's 25%. And then this is the current data right now, and I got this data from the countyhealthrankings.com. But while I was taking this class and I was just doing the research, I said, oh my gosh, someone needs to do something about this. This is ridiculous. Someone needs to help address the health inequities in Manning, South Carolina, as well as Clarendon County. So it wasn't until 2014 I asked myself, why not me? So this is where I birthed WellStart Initiatives, my nonprofit organization. My first major project was giving back to my hometown, Let's Move Manning. Let's Move Manning was a project that will encompass all ages, young, old, regardless of ethnicity, everyone to move, to take charge of their own health. So I proposed this to our city council. The mayor back me, Mayor Julia Nelson, was very supportive with this whole initiative. She wanted healthier citizens for Clarendon County, and even developed a task force. We had a committee that she organized. So I'm just so grateful for Mayor Nelson and the city council for backing me on this initiative. We had our big kickoff that July of 2014, where we had healthy cooking demonstrations. We had free workouts where we had Zumba, we had belly dance, and we had personal trainers who just volunteered their time, wanting to help better the citizens of Manning, South Carolina. I even had grocery stores that backed me, donating food, donating water to, make this event a success. And we also had we had free health screenings during this time. And that was our big kickoff. From there, walking groups was established, and also free workout classes. So that is how I was able to birth WellStart Initiatives. And I encourage you to turn your pain into purpose and your purpose into your ministry. And I also want to leave you with some tips for being living room fine before we go into our workout. So I know that right now we are, working from home. Well, most of us who maybe not considered are non-essential workers, we're working from home. So our step count is not as high as it used to be because we're just going from room to room. So I encourage you that on average, we are supposed to work out 150 minutes a day. So there are numerous of different workouts for free right now. You can always Google on YouTube. There's different workouts if you want to work on upper body today, lower body, whatever. Also, social media right now. We have wonderful social influencers right now who are doing free workouts right now on Instagram Live. Join in. My organization, WellStart Initiatives, we are also hosting some free workout sessions as well. So tune in. I also encourage you to, as well, I know snacking is a big thing right now. So I encourage you to do healthier snacks right now. What about some fresh fruits, some veggies? We can make a smoothie to replace one of your snacks. Trail mix, nuts. Encourage you to do that as well. Get some natural vitamin D. We can still go outside of our homes, guys. So I encourage you to do that. And I know sometimes we think that all carbs are bad. Every carb is not bad. I encourage you to do complex carbs versus simple carbs right now. An example of a complex carb is whole wheat bread. That can make a difference. And I also encourage you to not skip breakfast during this time. Breakfast actually stimulates your metabolism.